Today we're going to talk about 6 of the key decisions that you have to make when you're having cataract surgery. Now, a lot of patients don't realize they have to make any decisions at all. There's actually quite a few decisions you have to make, and those decisions are going to set up your vision for the rest of your life. So it can be pretty overwhelming to try to make those decisions right on the spot at that first consultation appointment. That's why learning a little bit about cataract surgery beforehand can help out a lot. That's what we're going to do today. Now make sure you stick around for decisions 4 through 6 because really those are the key decisions that will set your vision up and determine what it's going to be like for the remainder of your life after cataract surgery. Let's jump into it. Super quick, before we jump into these decisions, what exactly is a cataract? So we're all born with a natural lens inside our eye. When we're young, that lens is clear. Every year we get older, that lens gets a little more cloudy. When the natural lens inside our eye is cloudy enough where it's affecting our vision, we call it a cataract. So cataract surgery is a pretty quick, pretty easy procedure where we remove that clouded lens, we remove the cataract from the eye, and we replace it with the clear artificial lens. So that brings us to decision number 1, which is when should I actually have cataract surgery? Now this isn't quite as straightforward as it might seem. Most people actually will have a cataract for years that's being watched before they need surgery. When is the right time to go ahead and pull the trigger? And maybe equally as important, when is the time when insurance will start to kick in to cover some of the procedure? Now, the old school of thought here was that you should wait for your optometrist or your eye doctor to tell you that the cataract is ready for surgery or that the cataract is quote unquote ripe. Nowadays, really we recommend that you start considering cataract surgery whenever your vision is starting to affect your daily activities or affect your life. That means you're not able to drive, read, golf, crochet, recognize faces the way that you used to be able to or the way that you like to be able to live the life that you want to live. That's when the risk and benefit of cataract surgery starts to make sense. Importantly, that's also when insurance will start to cover cataract surgery. Now, your eye doctor, your optometrist can definitely still help you figure out where you're at in this process. Some people can have a very mild cataract that's bothering them a lot. Other patients can have a pretty severe cataract and not be bothered at all. So your eye doctor can take a look, they can see your cataract when they're looking at your eye during the exam. They can kind of let you know where it's at. I personally like to tell patients, hey, this is a mild cataract. Some people would be bothered by it. You probably would get some improvement. Or if it's a more severe cataract, I'll say, hey, most people would be bothered by this cataract even though you're not at this time. That helps patients kind of figure out where exactly they're at. So it's a little different for everyone, but in general, once that cataract is affecting your life, that's the time to go ahead and consider pulling the trigger and doing the surgery. And that leads us to decision number 2 when it comes to cataract surgery. Now that you're ready for the surgery, who is the right surgeon to do the procedure for you to get the best result? A lot of people will have a local optometrist or eye doctor they've been seeing for years. That optometrist will definitely have a cataract surgeon that they like to work with. Many people will go with that cataract surgeon, and for a lot of people that's a totally reasonable way to approach it. If you have good rapport with your primary eye doctor, there's a good chance that you'll have good rapport with whoever they refer you to. Cataract surgery is kind of the bread and butter of eye surgery. Most ophthalmologists will do cataract surgery, including general or comprehensive ophthalmologists. And if you're planning to have cataract surgery, what's covered by insurance, what we call basic cataract surgery, then really going with whoever you're referred to is a very reasonable approach. Just look for the normal things like a good reputation, good reviews, make sure that you have a good experience and that you trust your surgeon. Those are all important. Now, if you're thinking about having premium cataract surgery, where a laser might be used or you might use a specialty lens during the surgery to help get you out of glasses or contacts, then I would recommend seeing a cataract surgeon who also does refractive surgery. This is someone who does cataract surgery regularly, but also does LASIK and some of the LASIK alternatives. Now, these surgeons more than likely will have a higher level of preoperative equipment. They'll be able to take better measurements, particularly of astigmatism. A lot of times they'll have better options available for the surgery, like the use of laser. And just as importantly, these surgeons have the ability to do something like LASIK after the cataract procedure. One of the most common reasons cataract patients are unhappy is because they still have a prescription or they still have some astigmatism following surgery. There's no one who's more qualified to treat that with something like LASIK than a LASIK or refractive surgeon. And another thing to consider when choosing your surgeon is if you have any other eye problems that are going on that could be treated at the same time as cataract surgery. Now, a lot of patients have mild or moderate glaucoma. There's procedures called MIGS, or minimally invasive glaucoma surgery. These are done at the same time as cataract surgery. They usually only add a few minutes to the procedure, but they can help to lower the pressure and control the glaucoma long term. So if you have glaucoma, it's a good idea to make sure that your cataract surgeon can do a MIGS procedure. If you have more severe glaucoma, you may even want to see a glaucoma surgeon who can also do your cataract surgery, but possibly one of the more traditional, kind of bigger glaucoma surgeries at the same time to help control the glaucoma. This also can apply if you have a corneal problem, particularly something like Fuchs, which may require a corneal transplant at the time of cataract surgery. Now, your optometrist will let you know if that applies to you, but that would be a good reason to see a cornea specialist for your cataract surgery. And rarely you may also have retina problems going on. Now, retina surgeons may or may not do cataract surgery, but if you need cataract surgery and you need a retinal procedure, it's not a bad idea to see if it can be done at the same time. Really, overall, the key is to find a surgeon with the experience that you're looking for, who has the options available to you for you to get your best result. Your optometrist can definitely help you find that person. Now, real quick, before we get to decision 3, my name's Brad Sifrig. I'm a board-certified cataract surgeon. If you're finding this video helpful, make sure to subscribe to the channel. This is the Cataract Companion channel. It's a channel I made exclusively to help patients through the cataract surgery journey to help them get their best results. So if you or a loved one are having cataract surgery in the future, there is no better place to get information on it than this channel. After subscribing, once you finish this video, make sure to go over to the channel. There you'll find our frequently asked questions playlist. It's a playlist of short videos answering some of the most common questions to cataract surgery. There's already dozens of questions there. We're adding more every single week. If you have a question about cataract surgery, there's a good chance we may have answered it. Okay, now it's on to decision 3. So decision 3 is how close together should I schedule my cataract surgeries? So in the United States, it's pretty uncommon to do both eyes cataract surgery on the same day. Usually you'll do one eye the first day and come back at any point from a day, a few weeks, or even a few months later to do the second eye. Now, at least in my practice, most patients schedule that second eye within a week or a couple weeks of surgery. Really, even just 1 week is enough to see that that first eye is off to a good start healing, to be comfortable, confident going into the second eye surgery. Now, that being said, with how low risk cataract surgery is overall, I'm totally fine with doing the second eye the very next day. And in particular, if you're a patient with a high prescription, meaning you're pretty nearsighted now, but you're going to aim for your far vision during cataract surgery, well, during that in-between period, your vision may be pretty out of balance between the eyes. So if you have a pretty high prescription, it might be a good idea for you to schedule both eye cataract surgeries pretty close together, even maybe within the same week, so that that in-between period where things are out of balance won't be quite as bad. For most people, scheduling isn't the hugest deal. Really just look at what works for your schedule, what works with the clinic schedule. Whether you're doing it within a few days or a few weeks, the end result's going to be the same. On to decision 4, and this is where things really start to determine what your vision's going to be like following cataract surgery, what your vision's going to be like for the rest of your life. So decision 4 is, what are my vision goals for cataract surgery? There's a few different types of cataract surgery you may have heard about. There's basic cataract surgery, which is what's covered by insurance. Now, basic cataract surgery is done manually by hand. We're using a standard or monofocal lens. That lens corrects the vision for one distance. But really the goal of basic cataract surgery is to improve your vision or help your vision when you're wearing glasses. You should still expect to need glasses for all ranges after cataract surgery. Now, premium cataract surgery is a little bit different. It can sometimes involve the use of a laser. It pretty much always involves correcting astigmatism, and there's different specialty lenses that you can choose from. These lenses can do different things with your vision, like get your vision in focus at one range or even multiple ranges. The goal of premium cataract surgery is to make it so that you're less dependent on glasses after the surgery. With premium cataract surgery, with some of the different lens options, you can get good far vision or good up close vision without glasses. And there's even some lenses that we'll go through in a second here that can get you a nice range of vision where really you're not needing glasses hardly at all. Now, premium cataract surgery, your insurance will still cover a portion of it, but there's pretty much always some additional out-of-pocket costs, so that is something to keep in mind. Personally, I highly recommend correcting astigmatism at the time of cataract surgery. Correcting astigmatism will make it so your vision's in good focus at least one, if not more than one range. That will get you out of progressive or bifocal glasses, and there's some really great benefits to that long term. Things like cost savings, but also we know that progressive or bifocal lenses actually increase the risk of falls in the elderly. So it can help keep you safer and increase your independence as you get a little bit older. That brings us to decision 5, which is, what type of cataract surgery should I have? Now, we've talked about basic or traditional cataract surgery. That's done manually by hand. We're using surgical blades to do every step of the procedure. There's also laser cataract surgery or laser assisted cataract surgery that's available. Now, laser cataract surgery uses a femtosecond laser to do a few steps of the procedure for us in a very precise manner. It makes very precise incisions or openings to allow us to do the surgery. It also makes a precise opening of the cataract and softens up that cataract. That allows us to use less ultrasound energy to break up the cataract. It can lead to a slightly quicker recovery. It's a little bit gentler on the eye. Laser-assisted cataract surgery can be a little bit smoother of a procedure. In my opinion, it's a little more precise, a little bit more predictable. Because it's so precise, it can help with a good centration of the lens in the eye. That can be particularly helpful if you're having a specialty lens like a multifocal lens. Now, both methods of cataract surgery are effective. Both have good safety data. Really, most surgeons will have a way that they prefer to do the procedure. You'll even see on YouTube some people that are big proponents of laser-assisted surgery and some people who don't feel like the laser helps. Me personally, I do feel like the laser adds some precision to the surgery. I like that precision, I like that it's a little more predictable, and I like that I can use the laser to help correct astigmatism and give you better vision without glasses. Now this leads us to decision number 6 for cataract surgery. Really maybe the most important long-term decision, which is what type of lens will you have implanted during the surgery. This lens will be in the eye the rest of your life. It's typically very stable, so this is an important decision, making sure that the lens that you pick lines up with what your vision goals are for after cataract surgery. Going through these lens options can be a little bit overwhelming. The best way to do it is to think about what your goals are for your vision. Your surgeon will be able to recommend the lens that's going to help get you to those goals. When talking about intraocular lenses or IOLs used during cataract surgery, it's helpful to think about 3 different visual zones: distance, intermediate, and near vision. Now, distance vision, this zone is for when we do things that are far away, like drive, watch TV, or when we're doing things outside. When we say distance vision, really we mean anything that's further than arm's length away. The intermediate zone of vision is for doing things at about that arm length distance. That's going to include looking at the dashboard when you're driving, looking at a computer screen. That's typically about that intermediate range. Now, near vision is the zone for things up close. That's what we're using when we read a book, when we look at a restaurant menu, look at our phone or a tablet. Different lenses that are available during cataract surgery can get you good vision in one or even multiple of those visual zones. Now, before we jump into the different lens types, the lens categories, I do want to mention that I've actually made a comprehensive lens guide for cataract surgery that goes into the different lens categories, some of the differences between those lens categories, as well as the individual lenses within each category. This guide is totally free, so if you want access to it, just go down to the video description and you'll see a link where you can download it. Now, there are several different types of IOLs available. The first is our single range or monofocal lenses. These lenses are designed to get your vision in focus at one of those 3 visual zones. Most patients choose to aim for their distance vision. Some patients who have always been nearsighted or been able to see up close without glasses may choose to aim for their close vision and stay nearsighted. This is the only lens type that is covered by insurance. Now, with single range lenses, you should expect to still need glasses for the other 2 ranges that you don't aim for. Depending on how much astigmatism you do or don't have, you could still need glasses in all 3 ranges, unless you have something like premium surgery with the laser to correct that astigmatism. Now, within this single range category, we also have another type of lens, which is a toric lens. A toric lens is a single range lens that also corrects astigmatism. It's especially useful for patients with a medium or high amount of astigmatism. Because this lens is correcting the astigmatism, you can expect to see good in one visual zone, but you'll still need glasses for the other 2. Now, if you want more independence from glasses, you don't want to have to worry about using reading glasses after cataract surgery, then extended range lenses may be a good option for you. Extended range lenses can give you good far vision, good arm's length intermediate vision, and also good up close vision without needing glasses. Now, within the extended range lens kind of bucket, we have 2 different types of lenses. One is a multifocal lens, the other is our EDOF lenses. Multifocal lenses give the most range of vision. With a multifocal lens, you can expect to have good far, good arm's length, and good up close vision without needing glasses. Now, multifocal lenses do come with some side effects. You should expect to have visual side effects like halo or glare around lights at night, but a lot of times that's less than what you're having currently with your cataracts. Now, EDOF lenses give some range of vision, but slightly less range of vision than multifocal lenses. With EDOF lenses, you should expect to have good far vision, good arm's length computer vision, and some up close vision as well. Now for that near vision, for small things up close, you will still need reading glasses, but you may be able to get away with looking at bigger things on your phone or on a menu. Although EDOF lenses have a slightly lower range of vision than multifocal lenses, they do come with less visual side effects. So you may still have a little bit of glare or halo, but it should be significantly less than what you would have with a multifocal lens. Finally, there's a couple new lenses that are really exciting technologies that are actually pretty hard to put in these broader categories of lenses. These unique lenses have some unique benefits. This includes technologies like the light adjustable lens and also the IC8 Apthera pinhole optic lens. These lenses can give some range of vision. They have some unique benefits. They're really a little bit beyond the scope of today's video, but I do dive deep on these lenses in that free lens guide. So if you're interested in learning more, go down to the video description and download the lens guide. To wrap things up, these decisions during cataract surgery sometimes can feel overwhelming. They're especially overwhelming if you don't learn about them before going in for that consult. Now, having this base of knowledge will let your surgeon have a better conversation with you. They'll help guide you, help get you to the right decisions. Learning a little bit about these options before cataract surgery can go a long way to making the whole experience more comfortable, to making you more confident as you go through the journey. If you haven't already, don't forget to subscribe to the channel. This is the Cataract Companion channel, where my only goal is to help you have a better, more comfortable cataract experience. I'll see you in the next video.